multifactorial cases, so cases with endocrine, laminitis, osteoarthritis, they're the two things that I focused on today, but this does actually apply across quite a few different conditions that we're working with. So what is the problem? The problem, when we have cases that have painful hoof conditions and or osteoarthritis, so many of the cases that we're working with that have laminitis, that have endocrine laminitis or metabolic syndrome, they tend to be older horses, not always, but they tend to be older horses that have done a reasonable amount of work, and they've probably got, quite commonly, have got underlying osteoarthritis as well. And the first thing that we tend to do when we have a laminitic is to put it in a stable and reduce the movement, which for acute laminitis is obviously something that is sometimes needed and recommended by the vet just in those early stages. Now, that can be forced by management, so when we do put them in on box rest, that's something that we choose to do or we're advised to do by the vets or we think is the right thing to do for the pony at the time. The other time when we can get reduced movement, it's not always that we get a laminitic a bout of laminitis and we shut them in a stable. Sometimes the osteoarthritis or laminitic, they can be footy for a period of time before anybody necessarily picks it up. And during that time, there's restrictions due to pain. So they either go straight in a box and don't move, or their mobility starts to reduce because either they're footy, they are in pain because of osteoarthritis, or both. And gradually that mobility and the movement will start to reduce. So really, though, we do need to get these horses moving, standing still and having no exercise. I'll go on to explain why, but it's really not a very good idea. And so what is the solution? I'd like to think about how we can get these cases moving again and working together to try and get them moving as early as possible. So just briefly to look at the effects of reduced mobility, basically box rest is bad, most of the time. Obviously, sometimes we need to box rest them. If, like I say, if they're in acute, there's instability in the foot, then obviously there's a problem there. If they've got a fracture or something like that, obviously box rest is sometimes a necessary evil. But really, we need to get these horses moving much more quickly than we do. It's the very traditional way of dealing with anything is to stick them in a box and put them on bute. That's long gone as good advice, really. In the human side, we're always working with what the literature from the human side, really, and trying to bring that across. The research is getting better in our field, but it's still quite thin on the ground, certainly in areas such as exercise, rehabilitation, etc. But when we look at the human literature, physiotherapy-wise, if you go into hospital now and you have a knee replacement, you're up walking by the end of the day, certainly by the next day. Immediately the exercise starts. You're not in bed rest for 4 weeks, because that brings on a cascade of other problems, and it really is not the best way to try and rehabilitate anybody or anything. So when horses are either on box rest or reduced mobility, so I think as box rest is going sort of to 100%, not moving around, quite often we're at 30%, 50% of these animals just losing their mobility and not moving around as they should do. So firstly, there's a lack of blood flow and tissue loading. So they need to move around to increase blood flow. Blood flow is essential for healing, for delivering oxygen and nutrients to areas that need to heal. If we have a reduction in blood flow, then healing sort of stagnates, and that's why we tend to get chronic problems. So anything that's got any sort of chronic problem going on, if they stand still or they reduce their movement and they have a lack of blood flow, then that's going to really bring on some other problems. Obviously for lymphatic, I haven't put that on here, but lymphatics as well, that's a problem if we've got no movement. The lymphatic system really sort of slows down and almost grinds to a halt. So we also need to load the tissues. I mean, horses stand up most of the time, so they load the tissues just by standing. Obviously, if they're laminitic, they might be laying down a bit more. But the tissues need to be loaded to maintain their strength. And if they're box rest, certainly for a significant amount of time, then that really does bring on a problem that the tissues aren't being loaded and they start to lose strength. Muscle atrophy, obviously if they stand in a stable and they're not moving around, their muscles will start to waste away. This is a real problem, especially if horses have osteoarthritis, because there's then a lack of joint support. So the muscles are necessary to support the joints, and if they just stand in a box for a long time and they lose that muscle strength and the muscles start to atrophy, then you start to have a problem with the joints being more unstable, and that can be a real issue, especially, like I say, if they've got any degree of osteoarthritis. And obviously muscle mass helps with metabolism. So if we're looking at horses that have got a metabolic problem or compromised in some way metabolically, then losing muscle is not helpful, because they need the muscle to be able to metabolize, and that's, you know, an important part of the system. There's obviously a reduction in fitness. This isn't necessarily the be-all and end-all. It just means that when we bring them back into work, if they're less fit, then it takes us longer to be able to do enough work with them to make a difference. The reduction in fitness, it's not as quick as you think. They can stay quite fit for a reasonable amount of time in a stable. But it does mean that obviously if they're older and they lose some cardiovascular fitness, if we want to then start exercising them at a reasonable rate in order to kickstart their metabolism again, and try and get everything moving, then if they're unfit, there's obviously a bit of an issue there that we have to then have another factor that we need to bring into it, being cardiovascular fitness. Reduced range of movement is a big issue for even a healthy animal. When I go on in a minute to talk more about osteoarthritis, I'll explain why this is so important. But basically, when they're in a stable, they don't move. Their joints don't move through full range. They certainly don't trot or canter about. Well, we hope they don't anyway. So that's can be a big problem, and again can be linked to sort of the two factors, the two different conditions. Contracture. So this can be severe contracture. You know, if they really have a problem and they're off their feet, then the tendons will start to contract, and that then poses a problem when we want them to weight bear again, that they're very shortened in their tendons and they'll have a mobility problem and a weight bearing problem because of that. But also just on the basic side of that, on the lower end of that, when they just start to move around less and lose their mobility, then the muscles will contract and the tendons will contract a bit, and everything will just stiffen up. And, you know, that needs to be mobilised again so that they can move properly. And the other thing is atrophy of other structures, so tendon and bone, etc. Again, they need to be loaded, and if they're not being loaded and they're not being used, then they will waste away. Bone density will start to waste, etc. So we get problems in the other tissues as well. So osteoarthritis, just briefly to talk you through why this is a problem. I mean, I think probably a lot of the cases that you see will be osteoarthritic in some way, shape or form, if they're not a foal or a horse that does hardly any work. So the prevalence is very high. The statistic here, 60% of lamenesses is associated with osteoarthritis. This is taken from surveys a couple of years ago. So first of all, I think this is probably higher now because probably more research has been done in this area. Secondly, bearing in mind that these are lamenesses that have been identified. So these are horses that have presented as lame and have, you know, they've decided or they've come to the conclusion that there is an underlying osteoarthritis or there is a factor of osteoarthritis there. How many horses do we not see presented with lameness? You know, we then think about all the horses that are still working but have osteoarthritis. So I think that figure is probably significantly higher than that, if I'm honest. So just thinking about the downward spiral of disease and reduced movement, this is what I'm trying to get at today, because as a physio, I need the farrier's help to help me to get the horse comfortable so that it can move. And I think we need to work together a bit earlier and try and really put our heads together in the early stages with cases like this. So what the downward spiral of disease, I talked about this last year a little bit about a downward spiral, but I think that was more talking about posture, etc. But it's the same. What we're always trying to do with physio is break the cycles that are happening, the dysfunctional cycles. So whether that be degradation of a tissue, whether that be a change in a gait pattern, or anything like that, we're always trying to break that cycle and try and get everything back on a level playing field or where it should be. What tends to happen with osteoarthritis, and this is not just in horses, this is in humans, dogs, whatever, there is a downward spiral of disease. So initially there's some joint pain, which starts off, and then that brings about some pain and reduced movement. And with reduced movement, there becomes more disease because the joints need to move through their full range in order to maintain their health. The lubrication of the joints of synovial fluid, the oxygen, nutrients that are necessary to keep that joint healthy. The more and more the animal stops moving around, the less and less that happens. The joint capsule will become shortened and contracted. There'll be inflammation in the synovial membrane. There'll be inflammation in the joint capsule itself. There'll be subchondral bone problems, cartilage problems, etc. And this is all sort of gradually just gets worse and worse and worse. It's why it's a degenerative condition. So the fact that the animal stops moving around actually exacerbates that problem. You know, exercise for these animals is necessary, and it needs to be implemented. People tend to think, oh, they're stiff, do less with them, or, you know, be careful, back off. Yes, you do need to modify their exercise, but it's essential that they keep moving and that they have deliberate exercises, which we'll look at in just a minute. So the reduced movement is a problem because it's a cascade and it's a downward spiral of disease. Right, so exercise and osteoarthritis. The key points about this are that we need to have strength and flexibility in these cases. This is my daughter here doing gymnastics. She obviously gets it from me. You know, you can be there. You can have flexibility and strength together. So quite often we think about strength, people bodybuilding, etc., or you see people down the gym and are very muscly, but they've lost their flexibility. So you do actually have to train for strength and flexibility at the same time, and you can achieve both at the same time. So for these cases with osteoarthritis, as I spoke about before, with the muscles becoming lax, that really is a problem for the joints. So around the joints you have the collateral ligaments, obviously, and their job is to hold the joint in the right position, or not allow it to move outside its natural plane of movement. And then on top of that you have the muscles, and they have a real key part to play in the stability of that joint and the function of that joint. And so when they waste away, there becomes instability in the joint, and the joint ends up relying more and more on the ligaments to hold it in position, and the ligaments aren't really strong enough to do all of that job by themselves. So that's when they start to degrade and break down, and that's why we see ligament problems around joints as well. So if we can strengthen the muscles around the joints, that will provide stability for the joints and allow the pressure to be taken off those ligaments again and allow for a better functional movement. So it's absolutely essential that these animals keep working and that they're provided with specific exercises for muscle strengthening, not just get on and go for a hack. You know, there should be targeted exercises for them to help increase their muscle strength. Also, their flexibility is essential. So just thinking about what I just talked about, the downward spiral, we need to move those joints through their range of movement as often as we can and push them further than they want to go. Not into an unnatural range, but back to their full range of movement, because once they get osteoarthritis, that range of movement significantly starts to shrink down, and we need to mobilise that and stretch that and make them use that full range again for the reasons that I just discussed with dysfunction. In order to counteract that, we need to keep them flexible and keep those joints moving through their full range. Just thinking about what I've spoken about previously in posture and biomechanics, which we spoke about yesterday, this is another key factor of that. So as the flexibility reduces, the range of movement reduces, the mobility of the whole animal and the biomechanics, it all goes wrong, and the animal becomes much stiffer, and it affects all the different parts of the body. So we must make them flexible again so that they can move in a natural way again and hopefully load their limbs properly, etc. Aerobic exercise is another thing that's recommended. This comes over from the human literature again. that's really because we need to, we don't want extra weight on them. We want people to be fit and healthy, and we want horses to be fit and healthy. So aerobic exercise is good. It does increase the blood flow. It does increase aerobic exercise or fast work will actually induce angiogenesis, which is the growth of new capillaries within the body to deliver more blood to more areas. So it's a good thing to do aerobic exercise for whatever reason. Obviously, you need to be careful. I put low impact a little bit further down there. Have to then modify their exercise so that the impact is less. So low dose, low impact exercise. Think about when the ground's hard. Think about, and obviously that might be where shoeing can come in, remedial shoeing with pads or different shoes to help with that impact and that concussion element. Obesity. So obesity is now being termed a chronic mild inflammatory state. So horses that are obese or are overweight are putting themselves up, well, they're not putting themselves, their owners are putting them at more risk of any inflammatory condition. So the inflammation in their body is higher because they're obese. So there's pro-inflammatory cytokine production with obesity and with growing weight gain. So that's something we really don't want. So these animals that are overweight, we always used to think, well, animals that are overweight, we need to reduce the weight on their limbs, and that is a key factor as well. The heavier they are, the more pressure their limbs are taking, so that's better if they're not as heavy and that they're lighter and that their limbs don't have to take so much weight. But also there is this metabolic side to it, and that this cytokine production, these inflammatory mediators, are being released and produced because of the obesity, and that's eating away at their joints effectively, if you like. So it's never a good thing for a horse to be obese. And this targeted exercise is better than general exercise. So it's not just a case of, like I say, keep it hacking, keep it moving. All those things are good, but they need to have specific targeted exercise as well. And biomechanical optimization, which is what we were speaking about yesterday, really. So to have physio for these animals, to keep them moving how they should, and to try and take those forces off areas where they shouldn't be. Okay, so exercise and endocrine-related laminitis, we're obviously seeing more of this because it's becoming more and more recognised. So PPID and equine metabolic syndrome. I'm sure a lot of you are seeing cases of laminitis that are related to the endocrine system and some dysfunction and failure there. The exercise is really, really important in these cases. So exercise will improve insulin sensitivity and reduces insulin dysregulation, which is the key underlying factor in these cases. The fact that they're, have become insulin, they're not sensitive to the insulin anymore. That's really a massive problem. So the exercise actually reduces insulin dysregulation in itself. So it's not a drug, it's free, and it can be used to really work. So if we can get these cases moving, then, again, it's much better. There's a reduction of body mass. If they start working, they're going to lose weight, and we want that for all of them if they're overweight. They're not always. Some of these metabolic cases are thin. It's much more common that it's related to obesity, but there are the cases that are thin. They need to be managed slightly differently, but they still need exercise. It's still very important. So a single bout of aerobic exercise increases insulin sensitivity for up to 4 hours. Now, for a horse, this is a fast trot or a canter for maybe 15, 20, up to half an hour. 3 to 5 times a week is a suggested good protocol for exercise for these animals, but they need to be working. They need to be working quite fast. Their heart rate needs to go up. And they need to do that on a regular basis. This sort of activity, this sort of exercise actually has been shown to activate some of the same pathways as the traditional medication. So a lot of these horses will be put on metformin, things like that, which is a drug for diabetes in humans. They have to have massive amounts of tablets, and there's actually a big question mark over how well it's absorbed in horses. And doing exercise will do the same to a certain degree in a lot of cases, so activates those same pathways. And again, it's not a drug and it's free. Now, the problem is that, again, looking at the cases with osteoarthritis, or if they have other issues, it's not always possible for a horse that has been off its feet with this sort of problem to suddenly start doing half an hour of aerobic exercise 3 to 5 times a week. So we really need to think about, and that's probably the physio's problem there, you know, how do we get these horses to be able to get the heart rate up and to be able to work without putting this added stress on their joints, maybe sometimes on their limbs. There's some recent research, in fact it's just being done now, so I don't know, you know, what the results of it are, but we're looking at things like resistance band training for horses, so applying resistance so they have to work with more force against us, which will raise their heart rate, but doesn't mean they have to be trotting and cantering about for half an hour. So there's certain things we can do. Sometimes on a treadmill we can get that moving, or, you know, there may be other ways that we can do this. We need to think about surfaces. You know, these horses might not be ridden. So how do we get them? Put them on a lunge, canter them around in the school? You know, are they going to be able to cope with that? What surface have we got them on? So all of those things come into play. But what is absolutely clear is these horses have to exercise. They have to get their heart rate up. And it really helps them with their insulin sensitivity and the problems that they're having, which is ultimately what is affecting the laminitis in their feet or causing it. So these multifactorial cases, then, it's complicated because it's not always just one thing or another. It can be the two things that we've got to try and manage. Just a couple of points here that I just wanted to think about. In humans, this is a reference from a human paper, a recent human paper. Osteoarthritis related pain may also be aggravated by general factors such as metabolic changes and diabetes, genetic and physiological factors. So actually they found in humans that if you have osteoarthritis and you have diabetes, which is a similar, or metabolic syndrome similar to what we've seen in these ponies, your osteoarthritis pain can be worse. So again, we have to manage that metabolic problem with exercise to try and reduce the pain that they're feeling in their joints, essentially. So these things are linked. I think if there's dysfunction anywhere in the body, it tends to be, it's not just, it's like a domino effect. If you can get the weight off them, you can get them moving. You're sorting out lots of different problems that they're suffering with all at once, and hopefully one by one we'll start to knock the dominoes down and they'll start to get better all over. And obviously box rest may induce laminitis, so sometimes they have to be box rest for some reason suddenly, and obviously then we can get a laminitic episode because of that. So the two things tie in, they can't really be separated. Right, this is Finny, My Little Pony. So I just want to talk through a couple of cases. The reason why I've taken quite an interest in this is that I actually have two of these myself, two ponies like this myself. So this pony, Finny, obviously it's not a very clear picture of him. That's not him on the left, that's him doing a selfie with my daughter. He's only 11.2, and he's your typical, he looks like a typical Cushing's pony. He's got a sway back, he's got long coat, he's got fat pads. His skin doesn't heal properly when he rubs himself. He's a bit of a mess, but we love him. He's 24, he's absolutely useless, but he is our little yard mascot. And we've had problems with him. He's never ever been a laminitic pony, actually. Never had problem with him before. But I had him blood tested because I actually had him blood tested a couple of years ago because I thought he must be Cushing's. He looked like he was, and I was worried about him. He wasn't off his feet at that point, but I had him blood tested, and it came back, no, he doesn't have PPID, he doesn't have Cushing's. Over the next few years, the blood tests have become more sensitive. The things that they're testing for now, there's more understanding, and they're looking for different things. So he actually did go off his feet, and he was really bad. He had no shoes on at this point. He's been retired for a few years. When he was shod, he had pads because his feet are very flat, and he was always more comfortable with pads on. But obviously he's been out, not out in the field, but he's been retired for the last couple of years and has had no shoes on. So he suddenly went off his feet and was obviously laminitic. And I thought, this has to be. I can't be told this horse has not got some metabolic syndrome. Just by looking at him, I can see something's going on. So I had him blood tested again, and the blood tests, like I say, have changed. And he still wasn't PPID, so he's not Cushing's, but his insulin was absolutely through the roof. So the insulin concentration in the blood should be, normally it's less than 20 units per litre, and that would be a normal basal insulin blood test result. If you get getting towards 50 units per litre is a danger, what they put as a real red flag. That animal is in serious danger with the insulin in their blood. And actually, they're talking more about 20 to 30 for a pony like this would be a dangerous level. This pony's insulin was 400 units per litre of blood. So he was absolutely through the roof. The lab had never seen it. They had to redo it. They thought they got it wrong. They couldn't, and the vet had to ring twice to make sure they hadn't made a mistake. So it was absolutely through the roof. And so obviously that's why he was in trouble. Now, we put him on metformin. He was on bute, much too much than I would want him to have. We were just trying to manage his pain. And I knew that I needed to get him moving. I had to get him moving. It's just, being a physio, I just wanted to get him moving. That's all I could really think about. He was on massive amount of metformin. He was slightly improved. So I had a few weeks where it was just chronic and there was this, still this ongoing problem. In the end, I phoned my farrier, Oliver, who I don't think is here today. And I said, you're just going to have to come put their shoes back and put pads back on him, because he was always so much happier with pads on. It's your remit. I don't know exactly what he did, but he gave him more support in his feet, and he put pads on to make him more comfortable. And he just changed overnight, absolutely overnight. He was so much better. I just couldn't believe it, what the difference was. I knew he was going to be better, but I didn't expect him to be this better. But the next day, he was just trotting off, trying to drag me out to the field. And literally that was overnight. So I was then able to reduce the metformin to nothing over the next few days, and I was able to reduce the NSAIDs that he was on over the next few days to nothing. And he's not been on anything since, and that was months ago. As soon as he was happy on his feet, I could start to exercise him, and then from there he just got better and better and better. So I think with cases like this, we really need to work together if the farrier, as a physio, I'll be asking for help with cases like this and say, please, can you make this horse as comfortable as you can on his feet so that we can get it moving? And then we just need to work together to try to get them moving and get this sort of system working again. Just one more. Can you just move on one more? This is another pony of mine. We didn't have him blood tested, but I'm sure he's in the same situation. He wheezes a lot, he drinks a lot, and he'd gone off his feet. I thought, well, I'm just going to try the same with this one, and this worked as well with this one. He was, before this, I don't know if this video works, does it? Click it and see. If you go on one, does it go on? No. No. Is there not a play? No? Not working. Okay. Don't worry, go back to it. Well, it's not very interesting then. This is him galloping about. He doesn't live in this field, by the way, with all this long grass. I just put him out there to see if he could move. He went from being very pottery to being shod, and within 3 hours he was cantering around the field and jumping the grass in the field. It was an instant change again. So I could get him comfortable on his feet, I could start working him, and again, I've had no problem since. So obviously we need to work together. As always, I always talk about how we can all work together. I work now closely. I would work with any of these cases that I get to see. The first thing I'd want to do is get the farrier in and try to get them to help me get their feet comfortable. The problem we might have is how do we persuade the owners? I now have 2 very expensive lawnmowers. I'm prepared to pay for that because I value farrier. I'd never question what I'm being charged for farrier. I think it's very essential, and I think, what you guys do is amazing, and I'm very happy personally to pay for that. But I, like I say, have two very expensive lawnmowers. They can't even mow the lawn. They're just expensive horse ponies standing in the stable that have, a shot every 5 weeks and have pads and whatever else they need. Can we persuade owners of retired horses of 23, 24 to spend this money on their feet? That's obviously a problem and something that we need to perhaps do through education to owners and try and get them working with us and working on our side. The only thing the best thing I can think to try and persuade them is, one, the horse is in pain. I mean, what would I do with my roan pony if I didn't put these shoes on him? I'd have to have him put down, or I'd have to have him on bute, which wasn't even really working, but the cost of that was quite significant to have him on medication. So, if we can persuade people that, first of all, it's a welfare issue, something needs to be done, and second of all, you're going to save money on on medication, which is actually quite expensive. You know, NSAIDs didn't used to be that expensive, but now it's a pretty significant daily amount that we'd be paying for medication, and it gets to a point where it doesn't work. But this does work, or it certainly is a massive step towards making them comfortable so we can exercise them more. But then we do also have to persuade the owner that they have to then exercise. You've got a 23, 24-year-old horse that's supposed to be retired and they're having to exercise it 3 times a week. Will people put in that effort? That's something we need to try and persuade them to do. Working with the vet, obviously, is essential as far as medication. Initially, you know, if they're in a lot of pain, obviously they do need to be medicated. So we need to work with the vet in those early acute stages, as we normally would. And then the farrier and the physio working together, as I've explained, really. And if we can have a close working relationship over these cases, always in mind with the fact that we need to get them moving, we need to get them out, they need to move, they need to be in the field, and they need to be exercised. And if we're working on that same, from the same hymn sheet, then hopefully we can get somewhere with it. Okay? That's it.
Thank you very much.